Hi guys, so in today's topic we will be discussing about herpes virus. Most of the students they find it very difficult to understand about this virus and how they clinically manifest. So I will try to elaborate each and everything, and I will try to keep it very simple to understand. So let's begin. So remember, herpes virus is a type of DNA virus, and there are three types or three families are there of herpes virus, you can say. So we have alpha virinae family, we have beta, and we have gamma virinae. In the alpha virinae family we have HSV1 and HSV2 and HHV3. It is also known as varicella zoster virus. Now in the beta family we have HHV5. It is also known as cytomegalovirus. We have HHV6 and HHV7. And in the gamma family, we have HHV4 or human herpes virus 4. This is also known as Epstein-Barr virus. We have human herpes virus 8. And remember, this is the virus which is responsible for Kaposi sarcoma. Right? Now, let's first start with the herpes simplex virus 1. Okay. So, or you can start with herpes simplex virus, right? So there are two types of herpes simplex virus, which is HSV1 and HSV2. Remember, herpes simplex virus 1, it infects above the waist, and HSV2 infects below the waist. And remember, in both of the cases, in 99% cases, they are asymptomatic. Okay, only 1% is symptomatic, and in both of the cases, the virus will go and hide in the respective ganglion. If it is HSV1, so it will go and hide in the trigeminal ganglion, and if it is HSV2, it will go and hide in the sacral ganglia. So these two ganglia are affected in the herpes simplex virus. Now let's see the clinical manifestation. So first we will be discussing about HSV1. Right? So it is also known as acute herpetic gingivostomatitis. The disease which is caused by HSV1 is known as acute herpetic gingivostomatitis, and it is mostly seen in children or immunocompromised people. And remember, it is always associated with prodromal symptoms. Prodromal symptoms means before ulcer eruption. It is always preceded by fever or malaise, etc. Okay. Now, first there occurs vesicle formation, vesicle eruption. Vesicle means fluid filled blister, and what happens after some time, it rupture and forms ulcer, and this ulcer is covered with gray or yellowish membrane, which is surrounded by erythematous halo, and it heals. Right after some time, it causes secondary lesion. It is also known as recurrent herpes. So another name of this recurrent herpes is herpes labialis. It is also known as cold sore. And this cold sore is most commonly seen on the mammalian border and intraorally on the palate. And remember one very important thing, that this cold sore, it always appears, or mostly it is mostly appears on keratinized mucosa or keratinized area. Okay, and here also you will have prodromal symptom. So in this scenario, the prodromal symptom is itching. Okay, now, so remember HSV1, HSV1, it is associated with gingivostomatitis and keratoconjunctivitis. It is also associated with eczema herpeticum. And if ocular involvement is there, remember in this ocular involvement, steroids are not given. Steroids are contraindicated. So we use topical acyclovir. In case of herpes simplex virus 2, so it is associated with genital herpes and neonatal herpes. This neonatal herpes can be prevented by C-section, right? Then it is associated with aseptic meningitis. Okay. Now, in the histopathological examination, we have two types of investigation. One, we can take biopsy, or we can use cytosmear from the ulcerated area, right? So on the cytosmear, we will see Zank cell. So what is the Zank cell? So what is happening here? The squamous cell in the vesicle or blister, it imbibes the fluid and nucleus becomes swollen up. Then there occurs ballooning, degeneration of nucleus. So the ultimate cell, which is known as Zank cell. And sometimes inclusion bodies can be seen in these cells. So this is known as Lipschutz bodies. Okay, and remember, this Zank cell, it can also be seen in pemphigus in case of herpes zoster virus, cytomegalovirus. So we can say that it is not pathological with the herpes simplex virus. Okay, and the smear is known as the test, which is known as Zank test. For this, we use Giemsa stain or Wright stain or Pap stain, right? So this is all about the herpes simplex virus. Thank you.